In health news tonight, the latest on a new tick-borne infection similar to Lyme disease.
Well, Yale researchers have been following it closely, and now they're seeing more evidence of it right here in southern New England. News 8's medical reporter Jocelyn Mementa in our New Haven newsroom tonight, and she has an update. Jocelyn.
And Darren, this story really underscores the need to be vigilant when it comes to avoiding a deer tick bite. These Yale researchers are seeing more human infection in this latest study.
Take a good long look at these ticks. Be familiar with the deer tick. Know where they could be lurking. Do a body check after visiting high-risk areas. Not only do they transmit Lyme disease, now there is its cousin, Borrelia miyamotoi.
Right now, this is new, and physicians need to be trained or need to learn about this disease. We all need to learn about this disease.
Dr. Peter Krause at Yale School of Public Health is the lead investigator of a follow-up study tracking its prevalence in humans. Blood samples from 650 people in the Northeast were tested.
This preliminary data would suggest that this infection is not as common as Lyme disease. On the other hand, 4% is a high percentage.
A new antibody test developed in this lab helped to detect it.
Someone who has fever is better for a week or two and then develops fever again. Those are the patients especially physicians should be concerned about.
First found in Japan, Dr. Derlin Fish discovered it in black-legged ticks in Connecticut back in 2001.
All these tick-borne diseases are getting more prevalent and more common as the tick expands its range.
Why or how the tick is expanding its range is not clear.
Some of it might be due to climate change and other environmental factors, but I think in the future we're going to be seeing a lot more tick-borne diseases.
Already 6 diseases are linked to this same tick.
More importantly, and kind of disturbing, is that there's a virus in these ticks as well, a virus called Powassan encephalitis virus, and we've seen some cases of that around.
Typically, when tick-borne disease is diagnosed and treated early with antibiotics, the better the outcome.
Symptoms for this new infection include fever, chills, sweats, and headaches, but Dr. Krause tells me recurring fever is what makes it stand out. Right now, there's not enough data to determine whether it could lead to a more chronic condition. The antibody tests that help to diagnose it will be available for patients later this summer. Ann?